Welcome to Real Solutions. Tonight we'll be discussing health equity and the state of women's health. Health equity is a vitally important topic. Everyone deserves the opportunity to receive proper medical care. For many women suffering from fibroids, diagnosis and treatment options are not equitable. Today, I'm joined by Dr. Sarah Temkin from the Office of Research in Women's Health at NIH and Michela Bedard from Period.org to discuss what we can do to change this stark reality. Thank you both for being with us.
Thank you so much for having us.
Michela, you're leading Period.org, an organization that has created awareness like never before around period poverty and the earlier phases of the menstrual journey. Can you tell us about your mission?
Yes, thank you so much, Sateria, for having me and for inviting me to be part of this important conversation. Period is a global nonprofit. We are headquartered where I am here in Portland, Oregon. But we are a global nonprofit that's focusing on eradicating period poverty and period stigma through three main pillars of service, education, and advocacy. And we do that through a network of 400 period chapters around the nation and world, and over 400 nonprofit service partners that we work with to distribute period products.
That is absolutely awesome. I just love those stats. It's so impressive. And Dr. Temkin, you are leading the Office of Research on Women's Health at NIH, also known as ORWH. Your department represents women's health in a more focused and much needed way. Can you tell us more about the work that your organization does and maybe some of its origins?
Sure, and thank you so much for having me today. I'm so pleased to be here. And so the Office of Research on Women's Health was created in 1990. And really, the purpose of the creation of the office was around inclusion of women into clinical research, because in the 80s, there was a lot of social pressure from Congress and to Congress that women were not included into clinical research at the same rates as men. And this had a lot to do with women being thought of as being sort of messy clinical trials participants because they could potentially be getting an investigational drug and become pregnant or have their period. And so women had historically been excluded from clinical research. So that was the original mission of the office. Was to ensure that women were equitably represented in clinical research that is supported by the NIH. And today, actually, women do make up half of the participants in clinical research that's NIH funded. However, there's still more work to do, because just putting women into trials that are designed to answer questions that are applicable to men does not necessarily mean that we're studying issues that are meaningful to women and the health of women. And so our office organizes all 27 of the NIH institutes and centers on research that involves women and that's important to women. And so our role is really as a coordinating center to ensure that every one of the institutes and centers is focusing some portion of their research efforts on women's health.
I know for me personally, that definition of coordinating center is helpful because it helps to frame how your office functions. And so I appreciate that explanation. I'm sure that many of our listeners and viewers have not or not aware of ORWH. And so we wanted to make sure that they knew of the great work that Period is doing and of your office and the work that you're doing on the legislative and clinical level. Michela, what are some of the ways you talked about service, education, and advocacy? Can you expand on that and talk about some of the wonderful ways that you support the menstrual community? I love the comment about stigma because that's a huge part of what we all face when we are trying to lift up women and women's health.
Yeah, thank you for saying that, Sateria. I think stigma is really the root of a lot of period poverty. It's something that we've been afraid to talk about for millennia, certainly for the past many decades. And so we need to be able to get it at its root. And so Period is interested in solving things in a systemic way. Our first pillar is service. We distribute millions of pieces of period products annually to people in need. We do this through our chapters, through our service partners, and work to make sure that people who are living in poverty or on the margins of poverty have access to this essential good. The fact of the matter is, it's unaffordable and it's out of reach for many Americans. You can't buy period products through government funded programs like SNAP or WIC. So, if you're a family that's living in poverty, chances are you're making decisions between things like menstrual products and other essential needs for your family. And part of that distribution work that we do is working to do research in the space to find out where people really need product. We did a pretty landmark study last spring called the State of the Period Study that showed that nearly 1 in 4 United States students couldn't afford menstrual products. It's a shocking number. And I think because of stigma, it's shocking to people. We don't talk about things like menstrual supplies. That's just one of our pillars. The other two are education and advocacy. To really get rid of stigma and eradicate period poverty at its root, we need to be able to educate about menstrual health, both people with periods and people without periods, and making sure that people know that this is a normal part of everyday life. Everyone deserves products and access to education about their bodies. And then the third pillar that I think we may mostly be known for is advocacy. We work to promote menstrual equity policies across the United States and globally, primarily what we called affordability and access bills. So for right now, for example, 24 states tax menstrual products as luxury goods. We're working to repeal the tampon tax in those remaining 24 states. We're also working to mandate period products in schools, especially low-income schools, where students are really reliant on schools as their main access to government for a lot of their social and health and medical needs. So we work to promote those bills both in states and federally, and we do that mostly through a youth voice. We are gladly a youth-powered movement. They are what drives the engine of all of our programming, and they are, I think, what is going to eradicate period stigma once and for all. They have the bravery and the vulnerability to be able to talk about this topic like never before. So it's an honor to be able to work for an organization that equips and trains young people with the resources they need to solve this problem in their lifetime.
That is awesome, and I appreciate that. You touched on so many things that are important. When you talked about the affordability, I had flashbacks to a shopping cart half full of, menstrual care products, and that's expensive.
Yeah.
And I had a decent, paying job, and it was still a good chunk of my income as someone who experienced heavy menstrual bleeding and had to buy an abundance of products every month. In fact, I'd stock up for fear that I wouldn't have the products when I needed them or not feel well enough to go out and get them. So those are very real considerations. And I also appreciate you bringing up the fact that to erase this stigma, we need to have those without a uterus in this conversation as well. And I think that is pivotal. That's something that we focus on as well. And I'm so glad that you brought that up. And I'm really encouraged and uplifted by the work that you're doing. So thank you for all of the ways that you're reaching your community. Dr. Temkin, I'm going to come to you. Can you share with us a little about how what the funding structure is in women's health through ORWH within NIH?
Sure, I am happy to talk about it, and hopefully it's not too confusing because NIH is funded primarily through taxpayer dollars. It's the largest federal funder of biomedical research. It's the largest funder of biomedical research, I think, in the world. And the NIH budget, however, is distributed amongst the 27 institutes and centers that I mentioned earlier. So, as an office in the Office of the Director, the Office of Research on Women's Health doesn't directly fund research. We don't have direct grant making authority. And that's why our role is really to coordinate research across the institutes and centers. And so much of the research that's done on female specific conditions like fibroids or menses is actually done in the Institute for Maternal and Child Health, or NICHD. However, our office really tries to make sure that all of the institutes and centers are focusing on women's health, especially for things that are really multidisciplinary, like fibroids can be thought of as one of those things that require. It's not just a single organ site. Well, it is a single organ site, but it doesn't affect only one part of a woman's body. There are many and multiple effects on how they impact women's health. And the other thing I just want to point out is that in terms of funding of specific projects, the NIH funds projects based upon the applications that are received from scientists throughout the country and throughout the world. And so, something that we encourage people for some topics that may not have historically had a lot of funding from the NIH is to encourage applications, because if the NIH doesn't see applications on a topic, then they don't necessarily have the experts on review panels, and those applications may not be viewed as highly. And so it's really, really important when you're thinking about areas of medicine that may not have historically gotten the amounts of funding as other conditions or disorders, that scientists be aggressive and not be dismayed by that, but really be double down on their efforts and submit grants for funding.
Thank you for that explanation. And you brought up a lot of great points as well. One, I think, is when you're discussing how different scientific areas are studied or come to the forefront of being considered for study, I just want to highlight how important the patient voice is in that. Particularly for our listeners, and how collaborative, and our listeners are not only patients but clinicians as well. But the collaboration between patient and clinician or physician, if that's the term you're more familiar with, is critical, because each bring their own areas of expertise to bear on the issue at hand. And I actually almost giggled when you said that uterine fibroids are, multidisciplinary, because they absolutely are. Because although it is, the uterine lining and inside the uterus, good Lord, some of the symptoms associated with uterine fibroids are pretty pervasive within the body. So it often feels sometimes like it kind of takes on a life of its own outside of the uterus.
Can I? Oh, I was just going to add two more things, like just in terms of like
Mhm.
what we were just talking about in terms of stigma. I think this is a real place where stigma is a real concern. If patients aren't talking to their doctors about things, their doctors might not be interested, and then the science doesn't necessarily get done. And then the second point I just wanted to make about this is that last year our office have made a request for information. We opened up to public comments for what people had to say about research on women's health. And one of the things that I think was really most notable when we analyzed those comments was that women felt dismissed by their doctors or in a healthcare setting. And I think the female specific conditions, fibroids, and endometriosis, even just having their period, was something that people really spoke up about. And those were patients, researchers, patient advocacy groups that we got responses from. And that was a real theme that we noticed throughout those comments.
Real theme, and raising the patient voice is a real solution. And so I appreciate you sharing that, because it's important for people to know and recognize how they can participate in the process to help spotlight and find solutions to some of the voids in health equity. So that I'm glad that you had that open comment section, and I'm really pleased that the feedback and comments were taken to heart, and look forward to more of that collaboration. I think that's absolutely excellent. So thank you for sharing that. Michela, I'll come to you again. I know that we're starting to understand, I guess I should say, that uterine fibroids are sometimes diagnosed in the teen years. Have you found that this is a concern with your community members, or if not, what are some of their concerns?
Sadly, I don't think it is a concern around our community members, and it's something we're really working on. I mean, as you know, most diagnoses of uterine disorders come at a later age after years of suffering. And so one of the main things that our organization wants to do as part of our menstrual health education pillars is to make people who menstruate at a young age realize what is a normal symptom and what is not. And whether I think my symptoms are normal or not, what are some tips and tricks to advocate for myself in a mental and a both mental health setting, because we know it affects mental health, but also a clinician setting. So we work a lot with young people about how to have the right language about their bodies, how to self-advocate and ask questions so that things like PCOS, fibroids, endometriosis can be diagnosed at a younger age. I've heard your stories, Sateria, and stories of other patient advocates talking about, if only I had known, if only I had understood those stories in my family sooner, if only I had understood how to name that symptom and get that treated sooner, even if there certainly hadn't been a cure. Understanding your body and normalcy and what's not normal is so important. And so making sure that people understand that the stigma around periods is sometimes self-inflicted, right? Sometimes we don't know how to talk about it. We're shy about it. We're nervous about it. So we really do our best to talk about uterine disorders with people at a young age. I am sad to say, though, that we don't get a ton of interest yet. We get a lot of people who are in their 20s come back to us and say, oh my gosh, I was just diagnosed with fibroids. Or, oh my gosh, I figured all of this out. And I was so glad that I knew period, because I had a website that I could go to and took me down a rabbit hole to learn more about fibroids, for example. So we do get those stories. I would say, though, that the biggest thing that is affecting our community of primarily young women and girls is stigma and an early awakening to the fact of inequity when it comes to having their period. Simply not having supplies, realizing that, especially right now in a time of inflation, things are really expensive. It's hard to find tampons on the shelf. Those are things that really rile up young people right now. And, they are paying attention to this certainly much sooner than I did, certainly much sooner than a lot of older activists in the space. So I think they're much more focused on healthcare policy and affordability and accessibility policy. Notably, though, when we're talking about education, one of the things that our study found last year is that over 75% of young people reported knowing more about the anatomy of a frog than the anatomy of a person with a uterus.
Wow.
So doesn't that kind of set the table for what we're talking about, right? So of course they're not asking us about fibroids yet. They don't even necessarily understand the mechanics of how periods work. So I think there's a long way to go with menstrual health education for young people, but I am seeing more interest in it than ever before.
That is that really highlights the stark reality that we're facing. But I am very encouraged, and I remain encouraged by the power of one voice and the resources that you're providing to your community. How can someone find you or find a chapter, a period chapter?
Go to period.org. Thank you for asking. Follow us on all social channels at Period Movement and just give us a call. We are very responsive. We are here to be a resource for people. We're here to be a networker for people. We really aim to be a one-stop shop for anyone who is interested in periods or the menstrual equity space. If they need access to products, if they want to join the movement, please connect with us. We are really accessible. Easiest way is social media for a lot of people. But please also visit our website and get in touch. Our chapter numbers are growing by the week. There's a lot of people that want to get involved with us, so please join us.
Thank you for sharing that. And I also would like to highlight that if you're listening and you know a young person, a young menstruator, a lot of the erasing of the stigma that we can do is generational. So we can reach back to our younger friends and relatives and help to guide them beyond the struggles that we faced. So whether or not you are in need of period services at this moment, please do share their information with someone you care about. And Dr. Temkin, I'll come back to you. Can you share anything about how you see health equity evolving maybe over the next decade and how each person could potentially make a difference?
Sure. I mean, I hope that we have reached sort of a tipping point where we're having very important conversations around health equity. It's been basically my whole career that we've been describing inequities in health based upon race and ethnicity. I think we are only recently really ascribing those inequities to structural factors and figuring out how to fix some of those structural factors. And so to me at least, I think the conversation has evolved significantly over the last few years. In terms of women's health, I think we may still have a little ways to go. I think we're not always aware of all of the ways that structural sexism influences our health and our everyday realities, or things like what Michela's talking about as stigma, maybe based in some structural factors that lead girls and women to think a certain way about their bodies or their health. And so I think at the very least, we're having a conversation and we're starting to get at some of these root causes of inequities. And I think only until that happens can we really move forward. But I see a lot of promise. I think a lot of people are very invested in moving us forward into a place where we have more equity in health.
I couldn't agree more. And how can our community track the activities of ORWH?
So ORWH has a website, and we have a newsletter, and we're present on social media as well. We have some nice social media activities like what we call FOA Friday, or Funding Opportunity Announcement Fridays. So you can learn about, scientists can learn about different funding opportunities that are available that are relevant to women's health, sort of to spur people's interest in those things. We also, if people do sign up for the newsletter through our website, we have a whole lot of we have interprofessional education, or several courses that are designed to teach people, anyone really, from a regular everyday person to a scientist who's interested about sex and gender and how those influence health. And for anyone who's interested, I would definitely encourage participation in those courses. I think there's something for everyone in them, and there's even continuing medical education credits. I think those are a terrific resource.
That is awesome. I didn't know about the CME, so I'm sure our clinicians community knows about that and is happy to hear that reminder. Dr. Sarah Temkin, Michela Bedard, thank you both so much. This has been an enlightening conversation, and I'm happy that we could share how the concerns of our community are being addressed on so many levels by both of your organizations in really powerful ways. And I think the work that you're doing is important, and we are grateful for you and look forward to collaborating within this women's powered community, female powered community, to be able to really make a difference and erase those stigmas. So thank you for being here today.
Thank you so much. Thank you to Fibroid Foundation. Love your work as always. Happy to partner.
Thank
Thank you.
you. I'd like to especially thank our platinum sponsor, AbbVie, and our gold sponsor, Myovant Sciences Pfizer. Your support allows us to provide this much needed information. And thank you to everyone who has joined us today. We hope that you can join us again next Thursday, July 28th at 7 p.m. Eastern Time for Conversations on Capitol Hill. If you would like to support the Fibroid Foundation, you may do so through our donation button below. Your gift matters in our grassroots organization and our work to help women suffering with fibroids and heavy menstrual bleeding. Together, we are making a difference. Take care.